Diabetes is out of control, not only in our country, but in really worldwide. And too often patients are put on medication, they're told to decrease the sugar in their diet, and it's not helping. Obesity is still on the rise, diabetes is out of control, even when people are on drugs, lowering their insulin. So a doctor by the name of Dr. Barbara Corkey, and this is a decade ago, about 2011, a little bit more. She got an award from the American Diabetic Association for her work that has really not been embraced. It's been cited by thousands of research studies, so as far as its importance, but it hasn't been embraced in day-to-day medical knowledge as far as working with patients, and so I thought it was something we should review. Typically what we understand is that people with diabetes tend to eat too much refined sugar, refined carbohydrates. That raises their glucose. The body in response raises insulin, and the job of insulin is to open the doors for the cells and bring the glucose into the cells. And then as the glucose rises more and more because of the bad diet the person's eating, the cells, you could look at it this way, or like stuffed, they're so full, they're like, no more. And so the cells become resistant to the message from insulin to, no, open your doors, let more glucose in. And they're like, no, I don't want any more glucose, I'm stuffed. So what happens is the glucose can't get into the cells. This is called insulin resistance. And the glucose is circulating around the bloodstream. And at that point, you're typically diagnosed with diabetes, but also the glucose then tends to turn into fat in different organs, and so you get fatty liver, you can get trouble with blindness, kidneys malfunctioning, and so that's the downstream effect of diabetes. So this Dr. Barbara Corkey said, well, what else is it? If it's simply a matter of changing the diet and trying that way to get insulin under control, what are we missing if we have these drugs that are giving more insulin, right? And why is that not working? So her premise was, what is causing insulin to be high, that it's not the glucose necessarily starting it. Now, this is not to negate that high glucose doesn't result in diabetes potentially, but she was saying there must be another factor that we're missing. And so she's like, what can cause hyperinsulinemia, meaning high insulin in your blood? And the factors are interesting, and I'm going to come to that in a moment. But basically, she found that high insulin resulted in insulin resistance. So I just explained the age-old knowledge of high glucose creating insulin resistance, but also all that insulin, the body is very interesting in the way it reacts to too much or too little of something. So it's like there's all this insulin around, like enough already, and it pushes back on it. And so she said high insulin creates insulin resistance, and then we have the same problem leading to frank diabetes. So the question was, what creates the high insulin? And so she took glucose out of the equation to see what else could create high insulin. So it's very interesting. She talked about 400 factors in our food, and she didn't call them ingredients, she actually called them agents in our food that have been added in the last 50 to 100 years. I think it's more in the last probably 75-ish years. But 4,000 different agents that are not really ingredients, but they're agents in our food, additives to our food, preservatives in our food, emulsifiers in our food that were never there before. And emulsifiers, by the way, that's when like a fatty liquid and a watery liquid come together. Like if you make dressing at home and you have olive oil and vinegar and they don't want to mix, and so I make it at home myself, and then I just shake it and put it on the salad and it's fine. But when you buy salad dressing in the store and it doesn't separate, that's because of an emulsifier. So that's an example of one of these agents that have been added to our food, and there's 4,000 of them. And she found that these agents were associated with high insulin, therefore leading to insulin resistance, leading to all the inflammation, diabetes, and as we know, insulin resistance is associated not just with diabetes, but heart disease, cancer, Alzheimer's disease, etc. So this is a very key point if you know someone with type 2 diabetes. We're not talking about type 1, type 2 diabetes. They just can't get under control, and they're cutting out the sugar, diet sweeteners. You can treat it somewhat with cinnamon. Oh, thank you. So you can, these patients are frustrated because it's an ugly disease, diabetes. It's a life-threatening disease, and obviously you want to get it under control. And there's been a lot of studies that we know diabetes is reversible, but we're not necessarily doing the right thing. So what are we missing? We're missing these 4,000 agents in our food. So how do you avoid them? You eat real food. You eat food with no ingredients. You get real ingredients and you make your own food. And so all these processed, prepackaged foods are really creating an issue without the glucose. That's what's really interesting. So these were foods that didn't have glucose. She wasn't taking Twinkies and seeing if it raised insulin. Of course that would happen. These were foods with not a glucose factor in them that was creating this issue of high insulin. The other thing she found, which is really obnoxious for people who are, trying to avoid sugar, is artificial sweeteners. She particularly talked about saccharin. Again, this study was back in 2011. Recently, aspartame was listed as a potential carcinogen. This is just like this past week by the World Health Organization. So never been a fan of artificial sweeteners, and now that's coming home to roost. But back to Dr. Corkey, she found saccharin, of course, no glucose in that, was still creating this hyperinsulinemia, leading to insulin resistance. And then the third factor, really out of the ballpark, was excess iron. So we all need some iron, women more so than men when we're menstruating, but this was excess iron, so found in certain meats, obviously, but if you're doing it to excess, she found this was also causing this high insulinemia, high insulin in the blood. So 3 key factors: the artificial sweeteners, the excess iron, and then these 4,000 agents added to our food that are creating this issue. So just broadening the picture of what you need to do to get diabetes under control. It's very exciting because real food is what we need to do anyway. We know there's so many issues associated with all these chemicals that our body doesn't recognize, but hopefully you found this helpful. This is Friday afternoon. Some of you are out there. Thank you. I wasn't sure. The day kind of flew by. But I'll see you on Monday. Have a great weekend, and I hope this was helpful. Best of luck. Okay, bye.